In the only hospital serving a small, peaceful rural town tucked away in the rolling hills of Virginia, a dedicated nurse named Dana Reeves has spent the last 2 full years quietly perfecting the delicate and demanding art of complete invisibility. She moves through the halls like a shadow, never drawing attention, never raising her voice, and never allowing even the slightest hint of her true capabilities to surface. The chief physician there, Dr. Carl Merritt, treats her exactly like background noise, something unimportant that can be cut off mid-sentence, pushed aside from any critical decisions, and casually reminded in front of the entire staff with a kind of effortless cruelty that some people simply do not belong in the serious rooms where real medicine happens. Dana keeps her head down at all times, follows every single order without question, and swallows every humiliation in complete silence, exactly the way she was trained to do so many years ago in a very different world. But on this ordinary day, when a military transport returns from a routine field exercise carrying critically wounded soldiers, and a powerful war dog that should never have been loose suddenly tears through the emergency corridor, stops dead in the middle of all the chaos, lifts its nose high, and walks straight toward her with absolute purpose, everything is about to change forever. What that loyal animal carries gently in its teeth is about to unravel 2 long years of carefully maintained silence in under 10 dramatic seconds. Because there are secrets that no disguise, no matter how perfectly disciplined or practiced, can ever hide from someone who truly knows you on the deepest level. When the staff finally saw what the dog was carrying, the entire hospital fell into a stunned, heavy silence. The arrogant doctors froze right where they stood in complete shock, and Dana Reeves would never, ever be treated the same way again in that building or anywhere else. If this powerful story already has you hooked and your heart is racing just a little, hit that like button right now and let it fly across your feed so others can experience it too. And while you're there, drop a comment telling me exactly what state or country you're listening from today, because I read every single one of them and it means the world to me. If you're new here and this is your first time discovering these incredible hidden stories, hit subscribe right away and welcome to the channel where we celebrate the quietest people in the room who always turn out to have the most extraordinary and inspiring stories. Now, let's find out together what that incredible dog was carrying and how it changed everything in one unforgettable moment. The dog's name was Atlas, though Dana Reeves did not know that yet. She would learn it in approximately 4 intense hours, in a way she had spent the last 2 years trying desperately to prevent from ever happening. For now, in this very moment, she was simply carrying a plain tray of wound care supplies down the main corridor of Mill Haven Regional Medical Center, walking with her shoulders deliberately rounded forward and her eyes fixed steadily on the floor tiles, which was the exact posture she had practiced for so many months until it felt like a natural second skin that she could never remove. The hospital itself was small, only 32 beds in total. With just one single trauma bay and a total staff of 41 people when you counted the night shift custodians, though Dr. Carl Merritt did not count them because he simply did not count people he considered beneath his attention or notice. Dana, however, counted everyone without fail because that was an old habit from a life she had worked hard to leave behind. The corridor smelled strongly of antiseptic cleaners mixed with the faint, bitter aroma of burned coffee that had been sitting on the warmer far too long. Outside the narrow windows, the beautiful Blue Ridge foothills were doing what they always did so dramatically in late October, turning colors with such aggressive, vibrant beauty that patients from the cardiac ward would sometimes ask to have their chairs moved just a little closer to the glass so they could take it all in and feel a sense of peace. Dana had lived in places with absolutely no color at all, where the sand stretched out like old bone under a sky that felt like nothing, endless and empty. She found these Virginia hills almost excessive in their beauty, almost too much, and yet completely beside the point of why she had come here in the first place. She had been working at Mill Haven Regional for exactly 2 years, 1 month, and 11 days now. She had chosen this specific place with great care because it was small, because it was deeply rural, and because nobody from her previous life would ever have any reason to drive through Mill Haven, Virginia, a town that had only one diner, one gas station, one hardware store, and a single stoplight that blinked yellow quietly after 9 o'clock at night. She had chosen it because she wanted, more than anything, to disappear completely into the background and stay there. And for a long time, the plan had been working perfectly, just as she had intended. "Reeves?" The sharp voice stopped her in her tracks. Dr. Carl Merritt was standing at the nursing station with a chart held firmly in one hand and a look on his face that he had perfected over 30 long years of medicine and roughly the same number of years of uninterrupted sleep deprivation that came with the job. He was 54 years old, lean in the particular way of men who simply forgot to eat rather than men who made any effort to exercise. His eyes were permanently narrowed, as though the entire world was printed in a font that was always just a little too small for him to read without real effort. "The Kowalski chart," he said in that clipped tone. "I asked for updated vitals at 7. It is now 7:18. "I updated them at 7:02, Dana replied calmly. "They are already in the system. I do not want them in the system. I want them printed and placed on my desk." "Your desk is in the system," she said evenly. "Your preference for paper was removed from the standard protocol back in August." He stared at her then with the kind of intense stare that had made many residents break down and cry right there in the hallway. Dana had seen 3 of them cry during her 2 years at Mill Haven. She had quietly handed them tissues each time and kept walking without another word. "What I prefer," Merritt said slowly, as though he were speaking to someone who required extra processing time just to understand basic instructions, "is for my nursing staff to understand that in this facility I set the standards, not the computer system, not some distant protocol." "Me. Is that a difficult concept for you to grasp?" "No." Dana answered simply. "Then why are you still standing here instead of printing the chart immediately like I asked?" She turned without hesitation and walked straight to the printer. Her bright blue scrubs, the standard Mill Haven issue that every single member of the staff wore, moved quietly and unremarkably through the corridor. That was the entire point of how she carried herself now. She had learned very early in her career, her first and very different career that no one here knew anything about, that certain men required the full theater of compliance in order to feel secure. They did not actually want the thing they asked for as much as they wanted the act of asking to mean something powerful. They wanted the slight adjustment of posture, the drop in eye contact, the small but unmistakable performance of difference that told them the hierarchy was still perfectly intact and their position inside it was completely secure. Dr. Carl Merritt was exactly that kind of man, and Dana Reeves was very, very good at giving him the theater he needed. She was good at it because she had once been required to perform the complete opposite at an expert level in situations where lives depended on it, and the sharp contrast had given her a precise understanding of exactly how much space a woman could safely take up in any room before men like Merritt started to feel the uncomfortable pressure of her real presence. The trick, she had learned, was always to stay just below that invisible line. She printed the chart without delay. She carried it directly to his desk. She placed it exactly where he preferred it, in the upper right corner angled precisely 30 degrees toward the chair, a small preference she had observed and catalogued in her very first week without him ever telling her outright. He did not look up or acknowledge her. She walked back out into the corridor without a word. Elaine Cho, the experienced day-shift charge nurse, fell into step quietly beside her. Elaine was 51, Filipino-American, and had been at Mill Haven longer than the East Wing itself had existed. She had the calm composure of someone who had already outlasted 17 different physicians and fully intended to outlast 17 more. "He's been here since 4 o'clock this morning," Elaine said in a low voice. "I know," Dana replied. "The handover ambulance called it in earlier. 3-vehicle accident on Route 11. We are getting 2 of them. I saw the dispatch report. He's going to be impossible today." "He's always impossible," Dana said softly. "Today he will just have an actual reason for it." Elaine glanced sideways at her with a look that Dana noticed and filed away carefully in her mind. There was something in that glance, A quiet question that Elaine had never asked directly but that surfaced from time to time in the way she watched Dana work with such focused attention. Dana had always been careful. She was always careful. But some people were naturally observant in ways that had nothing to do with formal training, and Elaine Cho was definitely one of them. The new resident starts today, Elaine continued. Dr. Farhan. She is from Johns Hopkins. I know, Dana said. Merritt is going to eat her alive. Probably, Dana agreed. Hand me the saline bags when you can. Elaine handed them over right away. Dana began restocking the trauma bay cart with the kind of methodical efficiency that she had learned to perform slightly slower than her natural speed because her natural speed had a way of making people stop and stare in surprise. And people stopping and staring was never compatible with the invisibility she had worked so hard to maintain here. She had catalogued every single piece of equipment in the trauma bay on her very first day. She had memorized every expiration date, every supply level, and every small workflow inefficiency without ever saying a word about any of it. She had simply ensured the bay was always perfectly stocked in a way that the previous charge nurse had cheerfully attributed to improved vendor relations. It was not vendor relations at all. It was Dana running precise numbers in her head at 2 o'clock in the morning because old habits from her past were stubborn and sleep was not something her body had ever fully trusted again. The radio at the nurse's station crackled to life suddenly. Millhaven Regional, this is Hanover County EMS. We are 7 minutes out with a priority 1. Male, 43 years old. Blunt thoracic trauma from steering wheel impact. GCS 9. Blood pressure 80/60 and dropping fast. We have a line in but he is not holding pressure well. Elaine was already moving toward the bay. Dana was already 2 steps ahead of her, gloves pulled on, crash cart positioned perfectly, airway kit checked, suction line confirmed, defibrillator charge verified, and the O-negative blood pulled from the mini fridge and placed at bedside before Elaine even came through the door. Elaine looked at the complete setup and did that thing with her eyes again, the quiet question that lingered just below the surface. You've done trauma before, Elaine said. It was not quite a question but it carried real weight. I've done ER rotations, Dana answered simply. Elaine said nothing else, but the pause between them felt heavier than usual. The ambulance bay doors opened at exactly 7:42. The patient's name was Gerald Foss. He was 43 years old and he had hit a concrete divider at 62 miles per hour when the car in front of him stopped without any warning. The paramedics had done excellent work under pressure. His airway was intact. He had 2 large bore IVs running strong. His pressure was 84/58 and trending in the wrong direction. Dr. Merritt took one quick look and began directing the team with the clipped authority of a man who had genuinely seen far worse in his career and genuinely knew exactly what needed to happen in the next 60 critical seconds. Whatever else he was not incompetent. Dana knew the difference because she had worked with truly incompetent people under pressure and it looked nothing like this. Merritt was tired and cruel and dismissive of anyone he considered beneath him, but his hands remained steady, his priorities stayed correct, and in a trauma bay that was what truly counted in the end. Pressures dropping, the paramedic updated. 78/50. Tension pneumo, Dana said, not loudly, not as any kind of dramatic declaration, just the way vital information surfaces naturally when the evidence is obvious and the clock is moving fast. Merritt glanced at her sharply. What did you say? Absent breath sounds on the left side, distended neck veins, tracheal deviation. She kept her voice perfectly even. Tension pneumothorax. Merritt looked at the patient, pressed his stethoscope to the chest, and his jaw tightened just slightly. He picked up the needle without being asked. Second intercostal space, midclavicular line, 14-gauge angiocath. The loud hiss of escaping air was immediate and unmistakable, a sound Dana had heard in places with no ceiling and no guarantee of seeing morning. It still carried the same life-saving meaning it always had. Pressure released, clock reset, man still alive. Gerald Foss's pressure climbed steadily to 96/64 in under 90 seconds. The entire room exhaled in relief. Merritt looked directly at Dana. "Rotations," he said flatly. "Sir, you said ER rotations. Where exactly?" She held his gaze without flinching. "Several facilities. Urban trauma mostly." He waited for more. She gave him nothing else. The moment stretched out between them. "Fine," he said at last. "Finish the assessment, Farhan. Watch her hands, not her face." Dr. Farhan, who had arrived at some point during the needle decompression and had stood very still in the corner with the expression of someone who was recalibrating every assumption she had made about this small hospital in the last hour, nodded quickly. Dana finished the assessment with calm precision. She did not let her hands move at their natural speed. She kept them at the measured pace of a competent emergency nurse with good instincts and solid rotations, which was not the same thing as the speed of a woman who had once performed needle decompression in the dark inside a moving vehicle 3 kilometers outside the Pakistani border while someone fired from a ridgeline above. But it was close enough that Dr. Merritt kept watching her closely the entire time. He was still watching when she stepped back from the gurney and stripped off her gloves. And that single moment marked the very first small crack in the wall she had spent 2 full years building so carefully around herself. Gerald Foss was stabilized and on his way to Roanoke by 8:45. The second accident victim, a 17-year-old with a fractured radius and a mild concussion, was treated, braced, and discharged by 10 o'clock. Dr. Merritt disappeared into his office at 10:15. The morning settled back into its familiar ordinary rhythm of routine checkups, a diabetic crisis in room 7, a toddler with a button lodged in his left nostril, and the constant administrative despair of a rural hospital that was perpetually underfunded and perpetually overstretched. Dana moved through all of it with the steady, low-frequency hum she had learned to perform so well, keeping herself below the threshold of anyone's notice. She checked on Mr. Okafor in room 4, whose wife kept bringing fried plantains despite clear instructions not to. She said nothing about the plantains, adjusted his chart quietly, and spoke warmly to him about his grandson's soccer league instead. She checked on Mrs. Platt in room 9, 81 years old and recovering from hip replacement surgery, repositioning her carefully to avoid pressure points that no one else had even flagged. Dana corrected the issue quietly and without fanfare. She confirmed Thomas Driscoll's antibiotic schedule down to the minute. In the break room she drank exactly half a cup of coffee while standing at the window, rinsed the cup thoroughly, and returned it to the cabinet with the handle facing right exactly as she always did. Dr. Farhan found her in the corridor at 11:20. Priya Farhan was 29, small in stature, and carried herself with the careful confidence of someone who had worked extremely hard to earn a presence in rooms that were never designed to include her. She had graduated at the very top of her class at Johns Hopkins. Dana had looked her up because Dana looked everyone up. It was an old habit that refused to die. "Can I ask you something?" Farhan said. "Sure," Dana replied. "This morning with the tension pneumo. How did you catch it that fast?" Dana kept walking at her steady pace. "Experience," she said simply. "You noticed it before he even touched the stethoscope. You noticed it before anyone had done a full assessment." "Pattern recognition," Dana answered. The presentation was textbook. Farhan was quiet for 3 full steps. "I've been in trauma rotations for 2 years, she said. I've seen maybe 6 tension pneumos in real life. I've read about them my entire career. I would not have caught it that fast." "You would have caught it," Dana said gently. "Probably 8 seconds later." 8 seconds was fine today, Farhan replied. "You know what 8 seconds means in that kind of presentation," she added. It was not quite an accusation. It was more like a door being held open, an invitation to step through if Dana wanted to. Dana did not walk through it. "I've been a nurse for a long time," she said simply. "It all adds up over the years." She turned left at the junction and Farhan did not follow. But Dana heard her stop in the corridor behind her. She heard the small pause, the quality of someone standing still and thinking deeply. It was the kind of pause that always came right before a decision, and Dana had learned long ago to map the sounds of decisions being made the same way other people mapped faces. Farhan had decided something important. Dana did not know what it was yet. She filed the uncertainty alongside the quiet question that lived in Elaine's eyes and kept moving forward through her day. The afternoon continued in the unremarkable way that rural hospital afternoons often did, a steady, low current of need that never quite became a full crisis but also never fully released its grip on the staff. Dana moved through every task with quiet focus. She answered questions, documented vitals, managed the pharmacy log, covered Elaine's lunch break, and did not allow herself to think about anything that existed before Mill Haven. She had a system that worked. She was Dana Reeves from Charlottesville, nursing school at UVA, several facilities because she preferred change, which people always accepted without probing because nurses moved around all the time. She had come to Mill Haven because she wanted quiet. Every single element of that story was true in the way that partial truths are true. The rest remained carefully hidden architecture. She did not think about her first career during the daylight hours. She kept the seal on that part of her life intact at all costs. At 2:15 in the afternoon, Dr. Merritt appeared again at the nursing station and looked at the board. "Reeves," he called out. "Sir, the inventory request for the trauma bay," Dana began. "I've been asking for an updated list for 3 weeks now." "It's been updated. The system shows it current as of this morning. I need a printed list for the insurance review." "I can print it right now," she offered. "Why wasn't it printed already?" Dana looked at him and gave him exactly half a second of the blankest possible expression. "Because the request specified digital submission. The insurance portal does not accept paper." "The portal is down," he said. "I can print it," she repeated calmly. He stared at her in the way he had stared at her that morning, with the particular quality of a man whose instrument was reading something he could not quite identify or understand. "Where exactly did you train?" he asked again. "I've covered that already." "You covered it with the phrase several facilities, which tells me nothing useful." "It tells you exactly what you need to know," she said evenly. "My credentials are on file. I passed your competency review. Is there something specific you would like me to provide?" His jaw moved slightly. He was not a man who was used to being answered in this way. He was used to staff who deflected with apology, who softened every edge of pushback until it stopped being pushback at all. Dana had reached a line and she knew it. She stepped back from it carefully. "I'll print the inventory list now," she said, and walked to the printer once more. He watched her go. She felt the weight of his gaze without turning around. At 3:41 that afternoon, the call came in. It came first through the sheriff's department frequency, which the front desk monitored on a secondary radio that most of the staff had long stopped paying any real attention to because it was usually only traffic reports and noise complaints. Dana heard it instantly. Her body heard it before her mind even processed the words, which was a response so deeply trained that no amount of civilian routine had ever fully suppressed it. Something fundamental changed in the quality of her attention. Something sharpened and went cold and very still in the place behind her sternum where operational awareness had always lived. "All units, Ford picket training accident, Route 40 near the county line. Military convoy vehicle rollover. Confirmed 3 injured, possible 4. EMS en route requesting nearest medical facility alert." Fort Pickett was 40 minutes away under normal conditions. The county line was only 22. They were the nearest medical facility by far. "Elaine," Dana said, her voice carrying the particular quality of calm that actually means the opposite of calm in the most useful way possible. Elaine was already at the radio. "I heard it," she confirmed. Dr. Merritt came out of his office immediately. "What's the call?" "Military training accident on Route 40. "We're the closest," Dana told him. He looked at the board. They had 6 patients currently admitted. The trauma bay was clear. They had 1 surgeon on call, Drive Westfall, who was good but slow to arrive. They had 1 unit of O-negative left from the morning and a blood bank response time of 40 minutes. "How many coming?" 3 confirmed, possible 4. He did the math quickly. Dana watched him do it. It was the same math she had already run 2 full minutes ago before anyone else in the building had even processed the dispatch frequency. She had already ranked the injuries by likely severity based on the mechanism of a rollover in a military convoy on Route 40, a 2-lane state road with a posted speed of 55 and a real-world average of 68. "Call Westfall," he ordered. "Get the bay prepped for multiple casualties. Call Roanoke and tell them we may need to transfer depending on severity." "Already done," Dana said. He looked at her. She held his gaze steadily. "The blood bank call," he continued. "Also done. They're starting the pack process now. 35 minutes out." A muscle worked in his jaw. "Fine," he said. "Get the bay ready." She was already moving before he finished the sentence. The trauma bay had been prepped that morning after the Foss case. Dana ran through it again with the focused attention that military personnel apply to equipment before an operation. Not the checking of someone who fears being wrong, but the checking of someone who knows that right now, at this exact moment, this is the only thing that matters and therefore it receives the entirety of available focus. She ran the complete check in 4 minutes and 12 seconds. She knew the exact time because she always knew. Farhan appeared at the door. "Can I help?" Dana looked at her, assessed, and decided. "Blood pressure cuffs on all 4 stations. Check the seals on the suction lines. If there are blast injuries, we may get soft tissue damage. So pull the wound irrigation equipment and put it where I can reach it fast." Farhan moved without asking why. Dana noted that and filed it away. A person who moved without asking why in a moment of controlled urgency was a person worth knowing. Dana finished the cart setup and stood for 1 quiet moment at the window of the trauma bay, looking out at the empty ambulance bay that would not stay empty for long. She thought about the convoy. Fort Pickett ran infantry and armor training. Route 40 near the county line had a long straightaway that ended in a sharp curve that drivers often misjudged. A rollover at speed in a military vehicle meant secondary impacts, thrown cargo, blunt force injuries high, extremity fractures high, head trauma moderate, and junctional hemorrhage possible. She had supplies ready for all of it. She breathed deeply. This was the moment in her experience when the body made a choice, not a conscious choice but a deeper one. In the architecture of the nervous system, in the places where training and memory and identity lived below the level of thought, the body decided whether this was simply a situation or a mission. Whether she was Dana Reeves, rural ER nurse, or something else entirely. She breathed again. She told her body this is a situation. She was not sure her body fully believed her. She was not sure it mattered in the end. She heard the sirens first while they were still at least 2 miles out, which was another thing she did not explain to anyone. She was already at the bay doors when they opened. She was already at the bay doors when they opened. The first vehicle was a county EMS rig with a soldier in the back who was conscious and clearly angry about it, which was a very good sign. Specialist Marcus Webb, 26 years old, had a left shoulder dislocation and a dramatic scalp laceration that had bled heavily and was still bleeding enough to look far worse than it actually was. He was gripping the side rail tightly with his good hand and speaking clearly, which meant his airway was intact and his mental status was still functional. The second vehicle arrived just 20 seconds behind. Staff Sergeant Kevin Ortega, 31 years old, was suffering from blunt abdominal trauma. He was guarding his right side the way people do when something in the right upper quadrant is producing more pain than the brain wants to process. That usually meant liver or spleen. And given the rollover mechanism with seat belt injury and high-speed deceleration, the probability was clear. His blood pressure was 91/62, pulse 114, skin pale and slightly clammy. The paramedic briefing the team was using the calm, concise language of someone well trained, but underneath it you could hear genuine alarm. BP's been trending down for the last 8 minutes. We pushed a liter of saline and got about 90 seconds of improvement. He's guarding hard in the right upper quadrant. Percussion shows dullness. Hepatic hemorrhage, Dana said quietly, not to anyone in particular but to the entire room. Merritt was already there. He heard it. He did not contradict her. "Get Westfall on the phone now," he ordered. "Tell him this is not a come when you can call." "Already done," Elaine said from behind them. The third soldier came in secured on a backboard. Private First Class Deshaun Carter, only 19 years old. He had been in the back of the vehicle when it rolled and had taken the worst of the structural forces. Left femur fracture, right radius fracture, and a contusion pattern across his chest consistent with secondary impact against interior equipment. He was conscious, afraid, and very young. Dana moved to him first, not because his injuries were the most critical Ortega was but because his fear was a clinical variable that needed immediate attention. 19-year-old patients in pain who are also terrified have neurological responses that can complicate assessment and mask developing conditions. She took his hand with the measured pressure that communicates presence without sentimentality. "Deshaun," she said calmly. He looked at her. "I've got you. You're at Mill Haven Regional. Your injuries are real, they hurt, and we're going to deal with them right now. Are you with me?" He swallowed hard. "Yeah. Good. Tell me where it hurts the most." "My leg, and my chest." On a scale of 1 to 10, the chest pain? 7. Maybe 8. Does it change when you breathe deep? Yes. She ran her hands along his rib cage with methodical precision, reading the structure with her fingertips. 3 ribs, probably 4, with the fracture pattern consistent with impact. She palpated his abdomen carefully. His reaction was limited to the upper quadrant on the right, different from Ortega's pattern, but she filed it away and kept moving. "You're doing well," she told him softly. "I need you to stay as still as you can for me." "My guys," he said, voice cracking slightly. "Ortega and Webb, where are they?" "Both of them are talking and breathing," Dana reassured him. He exhaled in visible relief. She completed his vitals, ran the secondary assessment, flagged the ribs for chest imaging, and moved back toward Ortega's bay. What was happening there was organized but clearly strained. Ortega's pressure had dropped to 87/58. Merritt had a fast exam running, focused abdominal sonography for trauma, and the image on the screen already showed what the physical exam had suggested: free fluid in Morrison's pouch. The liver was bleeding. "He needs the ore," Merritt said. "Where the hell is Westfall?" 12 minutes out, Elaine replied. 12 minutes. Dana ran the calculation instantly in her head without being asked. Ortega's pressure was dropping at approximately 2 to 3 mm per systolic per minute. 12 minutes would put him at 62 to 65 systolic, a number with serious consequences. "Resuscitative strategy," she said, already moving to the blood warmer. "Permissive hypotension. Limit the crystalloid. Tranexamic acid now if we're still in the window." Merritt turned and looked at her. The expression on his face was no longer the one he had been giving her all day. It was different now, far more complex. "Time of injury was 43 minutes ago," the paramedic supplied quickly. "TXA window is 3 hours from injury." "Clear." Give the TXA, Merritt ordered. He was looking at Dana when he said it, not at the nurse standing at the medication cabinet. He was looking at her like a tool he had suddenly realized was very different from what the label claimed. She did not look away. She moved to the blood products and began the push using the exact sequence that had become standard in military trauma hospitals since 2010, something many civilian hospitals had taken years longer to adopt. Balanced resuscitation, 1-to-1 ratio of plasma and platelets alongside packed red cells, because the coagulation cascade matters as much as volume. That's a military transfusion protocol, Farhan said quietly from behind her. It's evidence-based, Dana replied. It's also what we have right now. Where did you learn it? Training, Dana said simply as she continued the push. Ortega's pressure steadied at 89/61. Not great, but not lost. Westphal arrived in 11 minutes and 40 seconds, faster than anyone expected because he had understood the urgency from the call. He reviewed the fast exam, reviewed the labs, reviewed the trend, and made the right call. Ortega was taken up to the OR immediately. Dana stepped back as the team moved out. The trauma bay now had that particular suspended quality of a space that had just been fully inhabited by crisis and now held only the debris gloves on the floor, discarded packaging, and the faint copper note of blood still in the air. She was beginning the automatic reset when she felt it first, not with her ears but with something older and deeper inside her. A change in the quality of the ambient sound in the corridor outside. A shift in the way sound moved when a large, fast-moving body enters a space not built for it. Then she heard the nails on the floor. She had heard that exact sound in compounds, forward bases, and places without names on any map, the rhythmic click of a working dog at full run. Her hands stilled instantly. She did not move toward the door, but her body was already turning because the smell that came in was not antiseptic and coffee and blood. It was desert sand, nylon webbing, and the unmistakable chemical note of a working dog's coat after a hard training run. The door slammed open with a bang. Atlas came in at full speed. 78 pounds of powerful Belgian Malinois in a tactical vest, having outpaced his handler by a significant margin. He crossed the trauma bay in 4 powerful strides and stopped directly in front of Dana Reeves. He sat. His eyes never left her face. In his mouth, held with the careful precision of a dog trained to retrieve rather than destroy, was a black nylon armband. The kind worn on the upper arm during training operations for field identification. This one had a call sign stamped on it in clear letters, Ghost Actual. Dana had not heard that name in 2 years, 1 month, and 11 days. She had never planned on hearing it again. The handler burst into the doorway, Corporal Jenkins, young, wide-eyed, and breathing hard. "I am so sorry," he gasped. "I don't know how he got off lead. He just bolted when we came through the bay doors." He stopped speaking when he saw his dog. Atlas was looking at Dana. Atlas had not moved. Corporal Jenkins had been working with Atlas for 8 months. He had seen him retrieve objects, secure suspects, locate IEDs, and perform room entries. He had never seen Atlas sit voluntarily in front of a stranger and refuse to move. Working dogs do not do that. They do not sit and wait unless they have found exactly what they were looking for. Corporal Jenkins looked at the armband in Atlas's mouth, then at the name stamped inside. He looked at the nurse standing in front of his dog. She was not moving. Her hands were at her sides. Her face had changed in a way Jenkins could not fully describe, a shift from the stillness of someone trying to be invisible to the stillness of someone who had become something else entirely. Her shoulders had changed. The line of her jaw. The way her eyes looked at the dog was not how people look at animals. It was how people look at something they had lost and never expected to find again. From the doorway, Dr. Merritt demanded, "What in the world is that animal doing in my trauma bay?" No one answered him. Jenkins said quietly, "Ma'am, that armband. Do you know what that is?" Dana reached down slowly. Atlas did not pull away. He lifted his jaw slightly and offered the armband the way a working dog offers a retrieve to its primary handler, not just any handler, but the one who owns the mission. Her fingers closed around the nylon. She straightened up. She held the armband in her hand and looked at it for one brief moment that contained the weight of 2 years and several lifetimes. Then she looked up. Elaine was in the doorway. Farhan stood beside her. Jenkins was still holding the doorframe. Merritt was behind all of them. The armband clearly read Ghost Actual. Atlas was still sitting, one paw now resting lightly on Dana's foot. Not aggressive, just saying, I know where you are. I am not leaving. Reeves, Merritt said again, his voice sharper. Dana looked at him. 2 years of silence lived in that single look. 2 years of wound care trays, printed charts, the theater of compliance, and the disciplined performance of a woman who was not what she appeared to be. She held the armband. She did not explain yet. The dog found me, she said quietly. The silence that followed lasted 4 full seconds. Dana counted them. Merritt's expression shifted from demand to something he could not name. Elaine's eyes moved from Dana to the armband and back. Farhan stood very still, processing at high speed. Atlas shifted his weight and pressed closer. Reeves, Merritt repeated. Dana looked at him steadily. She had rehearsed versions of this moment in her mind, but none of them matched this reality. She looked at the armband, then at Atlas. The rehearsed version dissolved. Get the dog some water, she told Jenkins. He's been in a rollover. Jenkins blinked, then obeyed. He found a clean bowl, filled it, and set it down. Atlas did not move from Dana's foot. He'll drink when he's ready, she said. He's not leaving until I tell him to. Merritt stepped closer. That armband. Ghost Actual. That's a call sign. Yes. Military. Yes. Whose? She met his eyes. Mine. The word landed with the weight she had spent 2 years trying to prevent. Elaine exhaled slowly, not surprise. But the sound of someone who had just received the final piece of a puzzle she had been assembling for 2 years. You were in a SEAL team? Merritt asked. It came out like a statement but was still a question. I was a Navy SEAL commander, Dana said. 05, Echo Squadron, Devgru. I left active duty 2 years ago. The silence in the room changed completely. It was the silence of an entire space recalibrating around new information. Merritt looked at her, then at the dog. Atlas worked with my team for 4 years, Dana continued. He was assigned to our unit. When I left, he was reassigned. She looked down at Atlas. I did not know he was at picket. He found you, Merritt said, almost in disbelief. He smelled you in the corridor and found you. Yes. The tension pneumo this morning. I performed needle decompression in the field multiple times. The TXA, the Balanced Transfusion Protocol standard in combat trauma since 2010. The blood bank call, the pressure math on Ortega, the tactical triage. You assess resources, severity, and logistics simultaneously. It becomes automatic. How long have you been here? 2 years. And before that? 14 years active duty. 6 deployments. Afghanistan twice. Iraq. Syria. 2 locations I won't name. The hallway outside had filled with people. 3 orderlies who had heard something. Specialist Webb on a gurney. And 1 other man standing with the absolute stillness of someone who had spent a career being still in dangerous places. He was 6'2", around 40 years old, wearing a Fort Pickett training uniform with insignia removed. He had a cut above his right eye. He was looking at Dana through the doorway. Dana saw him. Something shifted in her face, a wall becoming a window. Reeves, the man said, his voice low and specific. Commander, Dana replied. Commander Vincent Hale stepped into the trauma bay and stopped in front of her, looking at her the way people look at things they believed they had lost forever. Atlas stood up, turned, and made the low sound working dogs make when they have completed a task that truly mattered. Atlas stood up, turned, and made the low sound working dogs make when they have completed a task that truly mattered. Commander Vincent Hale stepped fully into the trauma bay and looked at Dana with an expression that carried years of shared history, silent operations, and unspoken understanding. For a long moment, the entire room seemed to hold its breath. Hale's uniform was still dusted from the training exercise, and the cut above his eye had been hastily patched with field tape. He stood there like a man who had just witnessed something he both hoped for and feared. Dana met his eyes without flinching. The armband still rested in her hand, the words "Ghost Actual" facing outward for everyone to see. Hale finally spoke, his voice low and steady. "He found you." "Yes," Dana replied quietly. "He found me." Merritt stepped forward, his usual commanding presence now mixed with visible confusion and something close to awe. "Commander Hale," he said, "this woman has been working in my hospital for 2 years under credentials I now understand may have been incomplete." Hale glanced at Merritt, then back at Dana. "Her nursing credentials are completely legitimate. She earned them after separation. She is also a former Navy SEAL commander with 14 years in Special Operations Medicine." The words landed heavily in the trauma bay. Elaine stood completely still, absorbing everything. Farhan's eyes were wide but sharp, processing at full speed. Corporal Jenkins remained frozen in the doorway, still breathing hard from chasing his dog. Specialist Webb, lying on a gurney just outside, called out weakly, "Is that Atlas? Is that our dog? What is Atlas doing in the hospital?" No one answered him yet. The silence stretched again, thick with shock and realization. Merritt looked directly at Dana. "Why," he asked, his voice quieter than usual. "Why work here as a floor nurse for 2 years when you carry this kind of experience?" Dana held the armband a little tighter. She looked at Hale, then at Atlas, who was now pressed firmly against her leg. "Because I needed quiet," she said simply. "I needed a place where no one knew me. Where I could just be Dana Reeves. Where the weight of everything I carried wouldn't follow me through every door." She paused, then continued, her voice steady but carrying deep emotion. "A mission went wrong. 3 members of my team did not come home. There was an 8-second gap between my order and the detonation. Whether those seconds truly changed the outcome, I will never know for certain. But I carried them anyway. I came to Millhaven to do small things, to check antibiotic schedules, to stock carts, to stay below the line. To disappear for a while." Atlas pressed his head harder against her leg as if he understood every word. Commander Hale nodded slowly, his expression one of deep understanding. "You've been carrying those 8 seconds like they were the entire mission," he said gently. "But they weren't. And the people in this building who are alive right now because of what you know and what you've been doing quietly for 2 years, they are real. You are real. This place found a way to need you exactly the way your old teams needed you." He looked at her with quiet intensity. "You've been Ghost Actual the entire time. You just stopped letting anyone see the call sign." Dana was quiet for a long moment. Outside the windows, the Virginia sky was beginning to shift into the rich purple-orange hues of dusk over the Blue Ridge Mountains. She had watched that same sky from the break room window for 2 years without ever fully allowing herself to feel it, because feeling it would mean admitting she was staying. But now, standing there with Atlas at her side and the armband in her hand, she realized she had been staying longer than she had ever admitted to herself. Merritt cleared his throat. "Reeves," he said, using her name differently now, without the usual etch. "Ortega is still in surgery. You should be there when Westfall comes out." Dana nodded. "I need to be there." She looked at the team. "One at a time," she said firmly. And not here in the middle of the bay. She glanced toward the corridor where more staff had gathered. Ortega first. Then we talk. Atlas followed her immediately as she walked out of the trauma bay, staying slightly forward and to her left in perfect position, exactly as he had done in compounds and forward operating bases across the world. Corporal Jenkins watched his dog walk away with the nurse and looked at Commander Hale with pure exhaustion. "Sir, what just happened?" Hale looked at the armband Dana had left on the counter. "A dog did his job," he said simply. He never forgot who his real handler was. The hospital corridors felt different now as Dana walked through them with Atlas at her side. Staff members who had barely noticed her for 2 years now stared openly. Whispers followed her like a wave. Elaine caught up with her quietly near the operating suite. "How is he?" she asked about Ortega. "Westfall says the repair held," Dana replied. "He's stable for now." Elaine looked at the armband Dana was still holding, then at Atlas, then back at Dana. "Ghost Actual," she read softly. "That's you." Dana gave a small nod. "It was. And, it still is." Elaine studied her for a long moment, the look of a woman who had waited 2 years for this exact clarification. "I'll update the charts," she said, and stepped away without needing more explanation. Dana sat down in the chairs outside the OR suite. Atlas immediately laid his head across her knee. For the next 40 minutes she sat there in silence, one hand resting on the dog's head, processing the day the way she had once processed outcomes in the field, not with dramatic relief, but with a quiet settling of the system, a recalibration from active management to post-event assessment. She had made the right calls today. She had made them because she knew exactly how to make them. She had been making them quietly for 2 years, and Ortega's stable pressure in the recovery room 60 feet away was proof of both what it had cost her and what it had been worth. Westfall finally came out of the OR at 6:47 p.m. He was still wearing his surgical cap. He pulled it off in the corridor the way surgeons do when the outcome is good and they want to mark the transition back to normal. He looked at Dana, at the dog, and at the armband in her hands. Word had already spread through the small hospital like water through old pipes. "Bleeding is controlled," Westfall said. "He'll need close monitoring for the next 24 hours, but the hepatic repair held. Good organ. He's young and strong." "Thank you," Dana said sincerely. Westfall looked at her for a long moment. "Elaine told me you called the hepatic hemorrhage before we had any imaging. It was the right call. 40 minutes earlier and we would have been fighting a much worse picture." He paused. "I'm glad you're here, Reeves. Whatever the circumstances." He walked away. Dana remained seated with Atlas, letting the news settle. Ortega was going to live. She had helped make that happen. A few minutes later, Commander Hale appeared around the corner. He had cleaned the cut above his eye. He sat down beside her without asking permission. They sat together in silence, the kind of silence that exists only between people who have shared enough truly quiet and dangerous places that words are no longer necessary. "Jenkins is beside himself," Hale said eventually. "Atlas is fine," Dana replied. "I know. Jenkins is fine too. He's just never seen a dog do that before." "Atlas was always unusual," Dana said with the faintest smile. "He was always yours," Hale replied. "Even after reassignment, he never transferred the primary bond. The other handlers, he worked with them, but he worked for you, even when you weren't there." Dana looked down at Atlas. The dog lifted his head and looked back at her with the pure, uncomplicated attention of an animal who had finally found what he had been searching for. The question, for him, was settled. "I should have called," Dana said softly. "Yes," Hale replied. "I didn't know how to call without explaining everything." "Yes." The same word, but heavier this time. "I didn't want to explain. I needed to stop being that person for a while." Hale was quiet for a moment. Then he said, the 8 seconds. Dana didn't respond. You know what the after-action report said, he continued. The detonation was outside the window regardless of order timing. The structural failure was preset. Your 8 seconds did not change the outcome. I know what it said, Dana answered. But you don't believe it? She turned the worn armband over in her hands. The nylon was frayed at the edges from the rollover. Atlas had carried it carefully, but it showed the marks of the day. I believe the report was accurate, she said. I just don't know how to make it stop mattering. Hale looked at her directly. 3 people were saved today. By you. Specifically by you. Ortega is alive because you knew the protocol, you knew the timing, and you made the call before anyone else in that room had even formed the question. That's not the same as what happened before, but it's real. And you are real. This place has needed you the way your old teams needed you. You've been ghost actual the entire time here. You just stopped letting anyone see the call sign. Dana was quiet for a long time, letting Hale's words settle deep inside her. Outside the window, the Virginia hills were turning that perfect shade of purple and orange at dusk, the same colors she had watched from the break room for 2 years without ever truly letting herself feel them. Because feeling them would have meant admitting she was staying. But tonight, everything felt different. The armband in her hands felt heavier than it should. Ghost actual, the call sign of someone who always led from the front, who moved first, who made the call and lived with the outcome no matter what it cost. She had tried so hard for 2 years to bury that person. And in one single afternoon, a Belgian Malinois with a mission of his own had brought her back to the surface. Merritt wants to talk to you, she said finally. I know, Hale replied. He's going to ask about a formal arrangement. Some kind of role that actually uses what I know. I imagine so, Hale said. What do you want to do with that? Dana looked down at Atlas, then toward the door, then down the long corridor of Mill Haven Regional Medical Center, this small, rural, underfunded hospital full of people who simply needed things done correctly. She thought about young Carter lying afraid on the backboard earlier. She had held his hand with the kind of steady presence that didn't need words, and he had exhaled like someone who finally felt safe. She thought about Ortega's pressure stabilizing, about Gerald Foss that morning and the hiss of released air from his chest, about Mrs. Platt's pressure points no one else had noticed, about all the quiet calls she had made before anyone else even understood the danger. She had been working at only 10% of her real capacity for 2 years. And even that fraction had still saved lives. I want to stop working at 10%, she said firmly. Hale said nothing, just listened. I want to be useful, Dana continued. I want to be here. I don't want to keep pretending this knowledge doesn't exist inside me anymore. That doesn't mean I'm going back to what I was before. No, Hale agreed softly. It doesn't. She stood up. Atlas rose with her instantly, anticipating the movement before it was even complete. Already oriented in the direction she was going exactly as he had done in compounds, forward bases, and places without names. Now he did it here, in a quiet hallway outside an operating suite in rural Virginia. The continuity of it hit her somewhere deep. Some things, she realized, do not change. Some things are not supposed to change. She clipped Atlas's lead herself. Jenkins had left it on the chair earlier, understanding that some conversations needed privacy. Dana looked at Hale one last time. The 8 seconds. I'm still going to need more time with that. I know, he said. You'll have it. As much as you need. She walked toward Dr. Merritt's office with Atlas beside her and the armband still in her hand. The hospital had grown quiet as the shift changed. Elaine was at the nurse's station and looked up when Dana approached. Something passed between them, not quite words, but deeper than most conversations. How is he? Elaine asked. Stable. Westfall says the repair held. Elaine nodded, then looked at the armband, at Atlas, then back at Dana. Ghost Actual, she read quietly. That really is you. Dana gave a small nod. It was. And it is. Elaine studied her for a long moment, the look of someone who had just received the answer she had been waiting 2 years to hear. I'll update the charts, she said simply. Dana kept walking. Merritt's office light was still on. She knocked once. Come in, he called. She entered. His office was small and plain: a desk, 2 chairs, a window facing the parking lot, and a framed license on the wall. Merritt sat behind his desk. He looked at Atlas, then at the armband in Dana's hand. He didn't tell her to sit, but she sat anyway. They were past formalities now. Atlas lay down at her feet with the calm finality of a dog who had completed his mission and planned to stay right there. Westfall says Ortega is stable, Merritt began. I know. He also said you called the hepatic hemorrhage before we had imaging. I did. Merritt was quiet for a moment. Outside, the parking lot lights had come on and the last colors of the October sky were fading above the roofline. I want to ask you something, he said, and I want a straight answer. All right. In these 2 years, how many times have you let a situation go further than it needed to because you were holding back what you really knew? Dana looked at him. She had prepared for many versions of this conversation, but none of them included Dr. Carl Merritt asking the one question that actually mattered most. Enough times, she answered honestly. Merritt's jaw tightened, not in anger, but in the way of a man receiving confirmation of something he had suspected and hoped wasn't true. Carter, he said. His rib fracture pattern. You flagged it for imaging earlier. Yes. You saw something else during palpation. What did you see? She met his eyes steadily. Subtle paradoxical movement on the lower left. It was minor, within normal variation for the mechanism. But I flagged it because the threshold for imaging in young adults with this kind of blunt trauma should be much lower than our current protocol. Merritt became very still. Paradoxical chest wall movement in a 19-year-old with blunt thoracic trauma. It was subtle, Dana said. But it is also the early presentation of a developing flail segment. Merritt stood up immediately and reached for the phone on his desk. How long ago did you palpate him? About 2.5 hours ago. He dialed quickly and gave clear instructions to the night nurse in Carter's room for an immediate repeat assessment and urgent imaging. He was already moving toward the door as he hung up. Come with me, he said. Dana followed. Atlas rose and walked with her. They moved through the corridor at that quiet hour, the low hum of monitors, careful footsteps, the feeling of a hospital between shifts and between crises. Dana matched Merritt's fast but controlled pace, the practiced speed of someone who knew running created panic and panic created mistakes. Carter's room was at the end of the south corridor. He was awake. His mother sat beside him, her face tight with the kind of composure only a parent fighting not to fall apart can show. The night nurse was already there with the portable imaging unit. Dana stepped forward. Hey, Carter said, his voice careful. Hey, Dana replied gently. I need to check something. She placed her hands on his chest with the same precise attention she had used hours earlier, reading through tissue to structure. The paradoxical movement was still there, subtle but now slightly more pronounced than before. Imaging, she said immediately. Merritt was already looking at the portable screen. The rib fractures were clear, 3 confirmed, a 4th possible. And in the lower left segment, the beginning of instability that, in another few hours without intervention, would have become something this small hospital could not handle alone. We catch it now, Merritt said, we can manage it here. Another 2 hours and he would have needed Roanoke, Dana added. He stays. We have the equipment. We have Westfall. Merritt looked at her. You know the stabilization protocol? Yes. Then we work it together. Dana nodded once. She looked at Carter, who was watching them both with the alert weariness of a 19-year-old who understood that the conversation happening over his chest was serious and about him. "Am I okay?" Carter asked, his voice small. Dana looked him directly in the eyes. "You're going to be okay," she said with calm certainty. "We caught something early. We're going to handle it right now." He nodded, trusting her. He glanced at his mother. His mother looked at Dana with that desperate, searching expression only a parent can have when a stranger tells them their child will be all right and they have to decide in that moment whether to believe it. She chose to believe. Dana saw the decision settle across the woman's face. The next 40 minutes had no room for anything except the work. Merritt worked with focused intensity. Dana worked beside him. They moved around each other in the small room with the natural efficiency of two professionals who had arrived at the same understanding of what truly mattered, even if they had taken very different paths to get there. He did not ask her to explain herself. She did not wait for permission. Elaine appeared in the doorway and received two instructions at once. She completed both perfectly and without delay. Dr. Farhan arrived moments later and Dana called over her shoulder without looking up, "Chest binder, 48 centimeters, not the 50. Farhan returned in under 90 seconds with the correct size. Carter's vitals held steady. The developing flail segment was stabilized. The chest wall movement calmed. The danger that had been quietly building was stopped before it could become a crisis. At 11:14 p.m., Merritt straightened up, looked at the monitoring screen, and said simply, "Good." It was the same word he used for routine chart reviews and inventory approvals. But in this room, at this hour, after everything that had happened, that single word carried an entirely different weight. Carter's mother whispered, "Thank you," in a voice that had used up almost all of its steadiness. Dana looked at Carter. He was staring at her with the expression she had seen many times on young soldiers after an operation that had gone wrong and then right again, the look of someone who had been standing on the edge of something terrible and had been pulled back safely. He now understood in the clearest possible terms what being saved really meant. "You knew," Carter said quietly. "When you checked me the first time earlier today, you already knew something was wrong." "I suspected," Dana replied. "I flagged it because I had to be sure." He was quiet for a moment, then said, "I've been in the army for 2 years. I know what it looks like when someone has been in a lot longer than that." Dana said nothing. "Whatever you were before," Carter continued, his voice sincere, "I'm really glad you were here tonight." She looked at him for a long moment. She was here. He was alive. Those two things were connected. "Get some sleep," she told him gently. She walked out of the room. In the corridor, Atlas was waiting exactly where Elaine had positioned him, close enough to see, but not in the way. He stood up the moment Dana appeared and fell into step beside her, slightly forward and to the left, matching her pace perfectly. She stopped at the big window at the end of the corridor. The Blue Ridge Mountains were now just dark shapes against a deep blue night sky, with stars beginning to appear one by one. She had stood at windows like this in places that no longer existed on any map she could show people. She had also stood at this exact window for 2 years. She placed her left hand on the cool glass and looked at her fingers. She thought about what Carter had just said, "Whatever you were, I'm glad you were here." Atlas pressed his head into her palm the way he had always done, a silent communication that needed no words. Behind her, she heard familiar footsteps. Hale stopped beside her at the window. They stood together without speaking, the woman, the man, and the dog, with the full weight of the long day settled around them. "Carter's stable," Dana said. "I heard. Flail segment, early stage. You caught it?" "We caught it," she corrected, glancing down at Atlas. Hale looked at her profile for a moment, then at the dark hills outside. "What did Merritt say?" "He wants to restructure my role." Formalize the trauma protocol responsibilities. Create a clinical liaison position between the nursing staff and the surgical team. She was quiet for a few seconds. The stars above the Blue Ridge were sharp and clear. Atlas leaned his solid weight against her leg. I said yes, she told Hale. He said nothing, but she felt his quiet approval. She looked down at Atlas. 2 years, 1 month, and 11 days of silence. Of staying small. Of living below the line. She had come to Mill Haven to disappear. What she had discovered instead was that certain people cannot truly disappear. They can only change location. They carry the same knowledge, the same hands, and the same ability to do the work, and eventually the work always finds them again. The only real question is what they choose to do when it does. Today, in 3 different rooms, she had answered that question with the same answer every single time. Atlas pressed his head even harder against her leg. She looked out at the stars. Ghost Actual had never left. She had simply stopped pretending she wasn't still that person. She looked out at the stars. Ghost Actual had never left. She had simply stopped pretending she wasn't still that person. The hospital was quiet now, deep into the night shift. The usual low hum of monitors and soft footsteps filled the corridors. Dana walked slowly with Atlas beside her. The Belgian Malinois moving in perfect step as if he had never been away. For the first time in 2 years, 1 month, and 11 days, she walked without rounding her shoulders or lowering her eyes. She walked as herself. Elaine was still at the nurse's station. She looked up as Dana approached. Their eyes met, and in that single glance passed years of quiet observation, respect, and understanding. No long explanation was needed. You're staying, aren't you? Elaine asked softly. Yes, Dana replied. I'm staying. Elaine smiled, a small but genuine smile. Good. This hospital needs you. More than you know. She glanced down at Atlas. And it looks like he needs you too. Dana continued down the hallway, the armband still in her hand. She could feel the weight of everything she had carried for so long, but for the first time it didn't feel like something she had to hide. It felt like something she could finally use again, not in the shadows, but in the light. She stopped one last time at the big window overlooking the dark Virginia hills. The stars were bright above the Blue Ridge. Atlas sat beside her, leaning gently against her leg, his warm presence steady and sure. Commander Hale joined her quietly, standing on the other side without a word. The 3 of them, the woman, the man, and the dog, stood together in silence, watching the night. Some people come to small towns to disappear. But the strongest ones eventually realize they were never meant to stay hidden. They were only meant to rest, to heal, and to remember who they truly are. Then, when the moment comes, they rise again, not louder, but clearer. Not with force, but with purpose. Dana Reeves had spent 2 years trying to become invisible. Today, a loyal war dog named Atlas had reminded her that some lights cannot be turned off. Some call signs cannot be retired. And some gifts are meant to be used, even in the quietest places. She looked down at the black armband in her hands. The words Ghost Actual caught the soft hallway light. She closed her fingers around it gently, not with sadness this time, but with quiet acceptance. Ghost Actual was still here. And for the first time in a long time, she was no longer afraid to let the world see her. The end. If this powerful story of hidden strength, loyalty, and second chances moved you, hit that like button right now and let it fly so others can hear it too. Drop a comment below and tell me exactly what state or country you're listening from. I read every single one and it truly means a lot. If you're new here, hit subscribe and welcome to the family. This channel is all about celebrating the quiet heroes, the silent professionals, and the extraordinary stories of nurses who carry the weight of the world without ever asking for recognition. Share this video with someone who needs to hear it today, maybe a nurse, a veteran, or anyone who feels unseen. We'll see you in the next story. Until then, stay strong, stay kind, and never underestimate the quiet ones in the room.